Good morning. I am here with Dr. Bonnie Nedrow, and we're talking about her upcoming course in keto adaptation. So, welcome, Dr. Nedrow, to PME.
Yeah,
So let's
thank
jump.
you. Happy to be here.
Yeah, let's jump right in. You've been using keto adaptation in your practice for many years. Let's talk about, for the providers out there, what are the real challenges with utilizing keto adaptation as a strategy in a primary care practice?
Well, it's much more complicated than I thought it would be when I got into it. So I thought, oh gosh, we'll just put people on a ketogenic diet. They'll get into ketosis. We'll watch how they're doing. We'll look at their symptoms, and it'll be a great tool. And what I found when I really started working with people is back to that, people are individuals. And one of the things that really changes how we can use this tool is to be able to adapt it for those individuals. So testing and monitoring ketones, and then knowing what to do about it when people don't get into ketosis, because you'll find that, a good 50% of people will easily get into ketosis, and that's great. But for the other 50%, there's challenges, especially when people have underlying conditions like diabetes, for example, or hormonal changes such as in menopause, or they're just older individuals. So we look at the postmenopausal metabolism is so different than your 25-year-old male. So if you've got a 25-year-old male who's athletic and in good health, he's going to keto adapt like super easy. But when you have some other people conditions such as fatty liver, or they have some heart disease conditions, and you're like, how do I do this safely? How do I get them into ketosis and lower their inflammation and not cause more problems? And that's where it gets a bit trickier.
So, can you talk a little bit about testing? I know there's differing views about how to test. How important is monitoring in terms of keto adaptation?
I find it really key because as I'm trying to figure out, well, are we looking at adrenal malfunction? Are we looking at they're not eating the right food? They're not getting the right exercise. Stress is really high. Sleep is a problem. We're looking at those problems, and we're trying to get their body to go into ketosis. And really the best way to test is to test blood. And the reason why that is so important is there's different types of ketones. Most measures such as urine or breath are not going to measure beta hydroxybutyrate. And beta hydroxybutyrate is super special because it's not bound to a protein. So it can cross the blood-brain barrier. So as we go into adaptation and we're looking at survival, the body is going to say, hey, we need a lot of beta hydroxybutyrate. So we need a good way to measure that particular ketone, because that's the ketone we're going for. If we're really going to get not just making ketones, we're not talking about getting into ketosis, we're talking about keto adapting. And so being in a state where you can easily have metabolic flexibility and shift into ketosis at will. And you need to be making that beta hydroxybutyrate for the body to be that flexible with its metabolism. And so blood testing is the only way currently that we can measure that ketone.
So, you cannot see beta hydroxybutyrate in the urine. Is that correct?
You can't, and so it can be very confusing that at first when people are starting to keto adapt, they're using urine, they're like, oh great, I'm doing great. And then as they get deeper and they actually start making that beta hydroxybutyrate, we may be tricked into thinking that they're not in ketosis when indeed they are doing great. So it's important to get that marker to properly monitor.
So, I was paying careful attention when you talked about postmenopausal women, because I'm one, but also see a lot of patients, postmenopausal women. What is it about postmenopausal women that's so different?
All the hormones change. And so when we're thinking about metabolism and you start digging into what impacts metabolism, I thought there were maybe dozens of hormones, and really get in there as there's hundreds of hormones that are involved in this process. And we all know with working with hormones that as soon as you shift one system, then you're going to see a shift in all those other systems. So metabolism is much different when we're working with women who are no longer cycling. And we also have a lot of people who have adrenal issues. So then we've got menopause and people are leaning on their adrenals, but they're kind of shot. And so trying to balance that blood sugar, again, the adrenals are going to be key with those glucocorticoids contributing. And when we have menopausal issues, then we're not going to have a good balance. And so it just ups the ante for kind of tools out of the tool bag that we need to pull to help these women be successful.
Great. Another issue that's related to keto adaptation is detoxification. And I know this is something you specialize in. You're an environmental medicine specialist, as well as having a long career in obstetrics and looking at preconception care. How do you see keto adaptation as contributing to detoxification and lowering body burden?
Yeah, that's a great question. And it's one of the ones that I spent months wrapping my brain around when I was first working with this process. And what I came to is when we mobilize fat, which we do with a ketogenic diet, even without weight loss, we're mobilizing fat, we're moving things around. The fat soluble compounds that are stored in that body fat are going to get mobilized. And so when we think about that, I go, gosh, it's foolhardy, it's dangerous to keto adapt and to have that fat move and have those compounds move and get into the bloodstream and not do detoxification. So we're doing harm to our clients. And there's studies now discussing the risk of weight loss and obesity for this very reason, that health concerns can get much, much worse. So we're retoxifying people, essentially. Their body fat is a relatively benign place to put these compounds. They have the weight loss, they're dumped into the bloodstream. And where we see that, why I can say this with a good deal of confidence is when you look at the studies of bariatric surgery and that rapid weight loss associated with that process. And what we see is huge increases in organochloride pesticides and PCBs. So these persistent organic compounds are being released into the blood, and really some elegant studies on what happens over the course of a year. So we know we're doing this. And of course, those compounds are obesogens. So if we're looking to lower someone's weight and keep it lower, because that, again, is one of the biggest risks of significant weight loss. If somebody's losing 30, 40, 100 pounds, that they gain it back, then we're actually causing a lot of health concerns that they would not be experiencing if they stayed obese. And I would argue that a lot of those concerns are the experience of the body of exposure to endogenous toxins that are moved around with the burning of that fat.
So the way, I'm assuming the way that you teach physicians, doctors, clinicians, and primary providers how to utilize keto adaptation would increase the excretion of these toxic compounds in the urine and the feces. Is that correct?
Exactly. That's exactly correct. And so, I look at ways that we can do that, and some of them are empirical that we've done for a long time. So we're grabbing some of that information and then also applying the scientific studies to say, here are the pathways, and then using a lot of our naturopathic depuration practices to specifically address those fat-soluble compounds.
So important. That's so important. So I agree with your strategy of teaching, which is to learn by doing. And I understand, please feel free to go into specifics about this, that physicians and providers in your course are going to learn by doing. They're going to learn how to keto adapt themselves. Can you go into this a little bit?
Yeah, I think that that's key. I think that that's really important for most of our therapeutics whenever possible, that we experience them ourselves so that people can really get a sense of what it takes to do it, especially when we're doing big nutritional changes for people. What are the challenges personally? What are the pitfalls? And to experience that personally so that when we're supporting our clients through it, we can speak with some sort of personal authority, and they have a much higher level of trust in our abilities. I also love to teach this in a group. So that's one of the great advantages of having a bunch of doctors join and clinicians join so that we can look at all the different responses. And so it will be personally keto adapting and also hearing about the process and other people and saying, oh gosh, this is something that this person needs to do that's not necessary for me, but my challenge is over here. And that way people will get a good sampling of the various different obstacles that people go through in this process.
That's great. So I have also spoken with you about how you've used keto adaptation for some of the conditions that are plaguing our population: diabetes, prediabetes, insulin resistance, insulin insensitivity, fatty liver disease. Can you talk a little bit about how you think keto adaptation is a good strategy to actually treat those conditions?
Yeah, it's actually super exciting. And as I have been working with patients on keto adaptation, I've seen some remarkable things and some things that I didn't anticipate, some things that I thought, well, this will help. And I went, wow, this was miraculous. And I'd say that diabetes is a huge, huge area of excitement and something that I found a lot of success with in my practice of really changing those signaling. So there's so many inflammatory signaling processes that go on with diabetes, and then just that high level of sugar itself. And I see that keto adaptation is a key for both of those pieces. It ends up being very anti-inflammatory, and we can see this by monitoring people's CRP and see a significant decrease of that CRP over time when we're working with the detoxification, as well as just lowering general inflammation. It is definitely the most successful tool I've had in my 17 years of practice of getting a hemoglobin A1C into that normal range. So working with people with pre-diabetes in that zone where you're saying, gosh, this person's headed in that direction. And then actually turning around insulin resistance as we're not pushing that system with carbohydrates and we're shifting metabolism to fat burning. Fatty liver is another one I'm super excited about, seeing what happens with people's liver enzymes who have fatty liver and have those elevated liver enzymes, and tracking that and seeing that even without really significant weight loss, those enzymes are normalizing. And so that is gives me a lot of hope. It's certainly something right behind prevalence in diabetes being really high and fatty liver being really not so far behind that, and then all the associated health risks of that. So those are a couple places where I find that keto adaptation is such a powerful clinical tool in concert with everything else we do. So, think of it as a tool in your tool bag. So you're still going to reach for your herbs and nutrients and essential fatty acids, food. You're going to use those other tools that you know how to use. And this is going to be another really powerful tool in conjunction with those things that is going to make a big difference.
Great. And so how can interested providers learn more about your upcoming course? I know we have information on progressivemedicaleducation.com about the course. Anything on your own website that you may want to lead them to?
Yeah, you can certainly go to my website. It's keto-cleanse.com. And I've got some articles up there. And you can also go to my Facebook page. So again, keto-cleanse.com, where I'm sharing information for people who are going through the program. So Facebook is just such a great way to get word out easily to people about food choices and understanding detoxification and why you may want to keto adapt and what would be the benefit for you.
And we'll also have some of this content, if this is just a small snippet, we'll have some more content on YouTube TV, our YouTube TV channel for progressivemedicaleducation.com. So if you're listening to this, there are more snippets on YouTube you can look up. All right, we'll look forward to seeing everybody in the class coming this fall. We would love to hear from you. info@progressivemedicaleducation.com for all your queries. Thank you so much, Dr. Nedrow.
Hey, you're welcome. Thank you, Lynn.